very well. So those are some of the things that we do at our hospital.
Michelle.
Hello, I'm Michelle Merez Johnson. I'm a registered and licensed dietitian over 20 years. I'm currently working for Miami Jewish Health Systems. We have a nursing home, daycare centers, we have hospital, we have a pain unit, and we have hospice care. I worked before at Jackson Hospital, and I work for the state. I'm presently the lead dietitian and the day center manager.
So you can see, ladies and gentlemen, that we have two very qualified young ladies to talk to you about this issue. And I hope that as you listen this morning that you can learn something to help us to become healthier and better people. Because, you know, God says that he wants us to be in good health. He wants us to prosper. And I hope that we can learn that much this morning. It is widely recognized that the immune system is impacted by our nutrition. For some infections, it is clear that the immune system has a marked impact on how we heal and how we get better. So having good nutrition is very, very important. In this day of COVID-19 and the SARS-CoV-2 virus that has broken out in almost every country in the world, it's very important that we send a strong message as to how to keep our bodies and our immune systems healthy under these circumstances. Based on surveys conducted in India, Europe, the United States, and Canada, it has been estimated that 35% of persons who are 50 years and over have some demonstrable deficiency of vitamins or trace elements or some problem with their nutrition. So we believe that there's a wide population that can benefit from the things that we have to say this morning. So for my two panelists, Holly, we're going to start with you. And Michelle, I'd like you also to add to your answer to this question also. From a nutritional standpoint, is there anything that we can do to help our bodies fight during this health crisis?
Okay, so I'll start. Michelle will talk about like some preventative measures we can take, and I'll talk more about like treatment in case someone does have the coronavirus or any type of viral infection. So a lot of times when we're sick, we're not really feeling well, we have an infection, we kind of lose our appetite, so it's kind of hard to eat. However, it's very important to stay hydrated in whatever way possible, and that can be done by drinking teas, hot teas, soups, smoothies, something that's easy to take down so that you're staying hydrated and still getting nutrients. Smoothies, because using citrus fruits, mangoes, blueberries, strawberries. The vitamin C content definitely helps with the immune system, helps your body to be able to fight. That's really important. Vitamin C, zinc, a lot of these things can help while we're sick. Just making sure to also just be like rested, like get rest. Don't like try to go out and be too active because you want to give your body that time to heal.
To be perfectly frank, most of us have enough protein and starch in our diet. In America, we overdo protein and overdo starch. What we need to focus on right now is more vegetables and fruits. Also, a well-balanced diet will help build your immune system, but like I said, we always focus on the starches and the protein. So to help with that, we could add more, like she was saying, smoothies, but add also kale in it or leafy green vegetables as much as possible. Right now, a lot of people are concerned about the COVID, but to help to prevent and build it, we have things like coconut oil. You start off with 1 teaspoon and gradually work your way up to 2 tablespoons a day, which will help because coconut oil is an antibacterial, antiviral, antifungal fruit that we could consume and build our immune system. It's also good when your immune system is weak to help build it back up. So coconut oil is one of those things that most of us know about, where we just put it in our hair or on our skin, but it's good to ingest too. Just go to your health food store and they will direct you to the appropriate one that's for consumption. Garlic is also another thing that helps build the immune system. I'm going to give you a little bit of what I do at home personally every day. At night, I go home, I crush a garlic, I boil it a little, I leave it in a cup overnight. In the morning when I get up, I heat it up a little, and that's what I drink in the morning before I get going to work. So that helps build your immune system, and that helps keep and prevent you from getting other symptoms of colds, flus, and things like that. Also at night, I squeeze a lemon, and I heat it up, and I drink lemon tea at night with no honey, no anything in it, just lemon and water. That's also a really good way to keep your immune system intact. So those are things that I personally do, and most of the people that know me, they know I don't, like, if I get sick, which is a big if, I don't keep it for long. So those things could help build your immune system before you end up with the virus or a cold or things like that. And like I said, coconut oil helps to build it even when you're weak.
Right. And also wanted to add turmeric and ginger. These are two roots that are also very helpful with helping the immune system. They're anti-inflammatory, and so with a lot of what's happening with people who are getting the coronavirus, it's that it's causing pneumonia, which is a viral infection in the lungs. So the lungs are really inflamed, and turmeric and ginger kind of help to just decrease that inflammation a little bit. This is not to say that turmeric and ginger is going to cure you from the coronavirus. It won't, but what we're trying to do is help you manage the symptoms so your body can be strong enough to fight it off. And so that's something that you could add, make tea with or add it to smoothies.
Also, I always tell people when I do my lectures that as Seventh-day Adventists, we have the best book, The Messages for Health from Ellen G. White. A lot of people are following the diets and reading her book because we do have the information for us there.
Yes, that's very, very, very good information. I just want to follow up on this a little bit, though. I want to ask to both of you, how about the use of lots of sugar? You know, people like to add a lot of sugar to their drinks and stuff like that. Is that good for the immune system?
Well, it's definitely not necessarily good for the immune system. A lot of people do say that it's bad for the immune system. As far as what the science and the research says about that, there aren't too many claims that say oh, just avoid all sugar at all costs. Because sugar comes in different forms. It comes in the form of fruits. It comes in your starches. Then there's a processed sugar. So we know for sure that fresh, unprocessed foods are better for us anyway. So the sugar content in fruits is definitely not harmful. The fruits are good because of not just the sugar that's in it, but the vitamins, the minerals, the fiber that's in it. So we know for sure that eating whole, unprocessed foods are going to be best for us.
And also, as I said before, I drink the lemon with water with no sugar and no honey. So
good.
That's just a hint.
And how about probiotics? We hear this a lot on the news, and a lot of people talk about probiotics and how we need to use that to build our immune system. So what do you have anything to say about that?
Well, probiotics, like I said, if we do a balanced diet and eat what we should, we would be able to obtain and get those extra vitamins and minerals and everything that probiotics has in it in our food. But since we don't do what we're supposed to do, it's not bad to have probiotics because, like I said, we don't do exactly the portions that we should do of vegetables and fruits.
Okay, let's continue with the next question. COVID-19 is associated with lots of mucus secretion. We've heard that story over and over again. Are there any nutritional supplements or any nutritional suggestions that may be helpful in dealing with that and other complications?
Okay, so hydration, as I said before, is definitely a big help for that. Steam, not necessarily nutrition related thing, but steam definitely helps, either taking a hot shower or having your face over a bowl of hot water. Just be careful you don't burn yourself. That can definitely help. Honey can sometimes help, a tincture of honey, garlic, and lemon. That kind of tends to help reduce mucus production as well.
Other foods, they have pumpkin seeds. Watercress is a good source of decreasing your mucus. Also ginger, onions. So if you add those things to your daily meal, you could just take a garlic clove and cut it up in your meal and eat it that way. Or you could boil it like I usually do and then drink it as a tea. So there are several different things that could help. For the people that eat fish, salmon is a good source too. So.
Okay, next question. Are there any myths you've heard that may be detrimental or maybe more detrimental than helpful? You know, you see on WhatsApp and all these different social media communications, all these herbal and non-herbal things that people can do to try to make the COVID-19 disease go away, and that will kill the virus. There's so many stories about these things. Are there any real truth to some of these stories, or what would you say about that?
Okay, so there's a lot of myths that are going around, anything from like adding bleach to your water or drinking water every 15 minutes, all these different things. There's two that I want to touch on. There's one that I saw this morning that said fasting for 72 hours can help to rebuild your immune system. Our news article that I read that said that mentioned a study that was conducted. However, I couldn't really find a link to the study to actually read the study to see what the study actually said. So it's not really validated because I couldn't find the link to the study. The article didn't link the study. So we don't really know what fasting, like what they meant by that. Like some people, fasting for everyone's different. Like there's a different definition for that. Some people fast and they like only drink water, some only eat fruits and vegetables, some don't eat any food at all. So I'm not really, that I would say is very harmful, especially for someone who is sick. Like when you're sick is not really the time to start fasting. You definitely need to be hydrated and need to like eat as much as you can. And then the other thing, something I saw this week was something about lemongrass or fever grass tea. So I got a message in WhatsApp that said, breaking news from CNN. First of all, CNN did not say anything that was mentioned in that message. If CNN really did say something like that, then I should be able to go online and find it on CNN or find a reporter that reported it. Couldn't find anything like that. And the article also mentioned that they were feeding 3 cups of tea to the patients in Wuhan, China. Couldn't find any evidence related to anything like that. What the message was trying to get at is that there are these 3 compounds found in fever grass or lemongrass tea. The big name for those compounds is methylxanthines or theophylline. These are compounds that help to dilate they're bronchodilators, so they help your lungs to be able to function better. So the message was saying that these 3 compounds are found in lemongrass tea. It is true that those compounds are found in teas and chocolates. However, they're found in very, very small amounts and not in an amount significant enough to cure you from the coronavirus or any virus. It's not harmful to drink lemongrass tea, so if you do want to drink lemongrass tea or green tea or ginger tea or peppermint, it's helpful. I would say it's helpful, but to say that it's the cure for the coronavirus, that's not factual at all.
Right now, there is no cure. I've been getting a lot of things from people all around the world on Facebook, on my social media, and everybody's sending me this, oh, look at this food, that food. There is no food that cures coronavirus at this time. They're working on viruses, they're working on several things, they're doing research, but please, there's nothing in the food that would cure it at this time. You need to go to a doctor, you need to get treated and have the hospital tell you what to do and your physician tell you what to do. There is no one particular food. There's foods that will help build your immune system to help you fight it if you have it, and it's the food to build your immune system to help you keep healthy. But there's no exact food that will cure coronavirus. If you do, as we're talking about all these little hints and tips, if you do have a medical issue like diabetes or hypertension, please see a physician before you change your diet or add any of our suggestions into your diet. Please consult your physician and have a one-on-one consultation with your dietitian, because they will know what medications and what medical issues you do have.
Yeah, I thank you very much for that advice, because I find in medical practice that there's so many people who like to run after the latest fad and fancy, and they have not been proven. And because they have not been proven, a lot of people expose themselves to dangerous complications. I remember many years ago, a patient went to a faith healer and was told that she was healed from the disease, and then she developed congestive heart failure from complications from the underlying disease. She was not really healed, but those are problems that can develop. Last question: how has COVID-19 impacted your work routine?
Okay, so I'll start. I work at a hospital, so I typically see patients who are admitted to the hospital because of exacerbations and whatever illnesses they have. So how it's impacted us is that we're, in an effort to conserve the personal protective equipment, we're not able to see all of our patients, because some patients are in isolation either because of a viral infection or because of a bacterial infection, or maybe a GI infection or something like that. So typically, before the coronavirus, we were seeing all of these patients. We would just have to put on the necessary masks, gowns, gloves. But in an effort to preserve that, we're not able to see those patients. Instead, we call them, or we try to call the nurse to find out what's going on with them. Yeah.
Well, I work with the elderly, so it's affecting my population the most. I work with the senior daycare center / clinic, and we used to have our doors open every day so everybody could get a breakfast, lunch, and snack that is appropriate for their diet. However, now we have to deliver and prepare the meals, so we're only giving them lunch. So it's not exactly what the diet prescription is supposed to be, but we're trying to keep them as healthy as possible.
Well, I want to remind our audience today that no diet, lifestyle modification, or supplement can protect you from getting infected with the SARS-CoV-2 virus, or we call it coronavirus. So please do not leave here depending on anything that was said as gospel to keep you from getting the disease. The object of our conversation this morning is to help you to maintain good health and as sound an immune system as possible. But it will not protect you from getting the disease, and if you got the disease, it will not help you to be healed, or will cure the disease, as was said by our two dietitians. So I want you to remember that the only real protection comes when we practice the social distancing measures that have been outlined for us by healthcare, public health personnel, and when we practice good sanitation. And as you recently heard, that we've also been asked to wear protective covering as we go in the community. I have my Bajan bandana that I have to cover my face with as I go out, and we can encourage you to find something helpful to use so that you can protect yourself. Remember, adequate sanitation, washing your hands, taking a shower, not touching your faces, and wearing some kind of protective covering. Those are the things that will help you to not get the disease. I want to thank you very, very much for your attention with us this morning. I want to thank Holly and Michelle for their input. We are really, really grateful for them, and we hope that we have benefited you today. May God bless you real good.